Welcome viewers. Today in this video, I am going to show you the bones of the upper limbs with girdle in a color coded fashion to make the bones more discernible for better understanding. This color coded list shown here is according to the color of the bone present in this model. Different colors show different bones in this model. I am starting with the 5 metacarpals which have been shown in dark green color, forming the skeleton of the hand lying between the carpals and the phalanges. The proximal, middle and distal phalanges are shown in decreasing shades of green color. The phalanges are connected to metacarpals distally. Carpal bones distinction is as follows: trapezium in dark blue, scaphoid in blue, lunate in sky blue, triquetrum in Tiffany blue, pisiform in orange, hamate bone in purple, capitate in off-white, trapezoid in lavender color. The ulna is shown in purple and it is the medial and the longer bone of the two bones of the forearm. The radius in red is the shorter and lateral bone of forearm. The ulna and radius articulation sites are the elbow joint, interosseous membrane, proximal radioulnar joint and distal radioulnar joint. Colles fracture, that is fracture of distal end of the radius, is the most common fracture of forearm. Now you see the humerus in yellow, which is the largest bone in the upper limb. The nerve affected in the fracture of the humerus is the axillary nerve in the fracture surgical neck of the humerus. Radial nerve is involved in the radial groove fractures. Medial nerve is involved in the fracture of the distal end of humerus. In the medial epicondyle fracture of the humerus, the ulnar nerve is involved. The scapula in light green color is the upper limb bone which is most proximal to body. Its shape is triangular, flat bone extending between 2nd to 7th ribs. The function of the scapula is to give attachment to muscles. It has considerable degree of movement on the thoracic wall to move freely. The clavicle is shown in dull pink color. It is the only bone in upper limb that is placed horizontally. It has the appearance of an elongated capital letter S lying on one side. The function of clavicle is to give rigid support, transmit force, give attachment to muscles, and to form boundary of cervical axillary canal for neurovascular bundle protection.